Hello, my name is Siobhan Lewis, and I'll be presenting on non-speech oral motor exercises and treatment for speech sound disorders in children. Throughout this presentation, I may switch the wording between exercises and treatment as it applies to research or implementation. This disclaimer is to decrease possible confusion in the listener, as both words in this case are interchangeable. What is non-speech oral motor treatment? According to Lee and Gibbon in their review of non-speech oral motor treatment for developmental speech sound disorders in children, it is a non-speech activity that aims to stimulate or improve speech production and treat specific speech errors. They are usually employed to facilitate muscle relaxation and contraction, increase joint flexibility, and improve circulation. Here are some examples of different oral motor exercises. Feel free to try these as we move through them. We will also have a chance later to see how these are modeled for children to participate. Starting with lip exercises, the client will perform a lip press where you press your lips together for 3 to 6 seconds. A lollipop squeeze is where you hold and squeeze said candy with your lips for 6 seconds. Smacking your lips together is just how it sounds. The client would do this about 5 times in a row. For cheek exercises, the client will blow cheeks with air and hold for 3 to 6 seconds. It is also encouraged to make a silly face in the mirror. Looking at jaw exercises, both options involve candy. Tug of war refers to holding a chewy piece of candy in between the lips as you pull it away. For the sake of time, I will not go through the tongue and palate exercises, but take a look at these on your own time and try them out. The term speech sound disorders is technically an umbrella term. It refers to any difficulty or combination of difficulties with perception, motor production, or phonological representation of speech sounds and segments. The American Speech Language Hearing Association, or ASHA for short, helps our field understand that there are 2 types of speech sound disorders: organic and functional. Organic speech sound disorders are a result of an underlying motor or neurological cause, such as dysarthria or apraxia, a structural cause, such as cleft palate or structural deficit due to trauma or surgery, or sensory and perceptual, which is an example of this is hearing loss. Functional speech sound disorders are idiopathic. This means the speech sound disorders can arise spontaneously and/or have no known cause. In this case, articulation refers to our motor aspects and phonology refers to our linguistic aspects. We now have some background of what is a non-speech oral motor exercise, examples of exercises, and foundational information on speech sound disorders. The following slides will include information based on these research articles. Treating children ages 3 through 6 who have speech sound disorder, a survey. The use of non-speech oral motor exercises in the treatment of children with cleft palate, a re-examination of available evidence. Non-speech oral motor treatment issues related to children with developmental speech sound disorders, and evidence indicates non-speech oral motor exercises for children with cleft palate are not effective. Let's look at a re-examination article that allowed researchers to evaluate the current literature on non-speech oral motor exercises in general and their use in the treatment of children with a structural organic speech sound disorder, a cleft palate. PICO is a method for formulating clinical questions that have been described in the literature. P is for patient population or disorder of interest or problem of interest. In this experiment, the population is children with velopharyngeal dysfunction and compensatory speech sound disorders. I is for intervention or range of interventions or any clinical maneuver related to assessment and intervention. The intervention of this experiment are non-speech oral motor exercises implemented before or parallel with other treatments. C is for comparison of intervention. Non-speech oral motor exercises were compared to phonetic and phonemic treatments for speech sound disorders. O is for outcome of interest. The experiment's outcome showed improvement in resonance and speech sound production. In this case, a very small subset of subjects reported this outcome, but the capability of this improvement can only be determined through assessment that involves perceptual and physiological assessment data. What are the considerations and limitations of non-speech oral motor exercises? The considerations are that they may strengthen the articulators and improve muscular range of motion and coordination. Fraser says that this approach was developed prior to current advancements in speech production research. Moving over to limitations of this approach, SLPs need to select treatments for their clients that have been subject to empirical scrutiny. Russello published a literature review of non-speech oral motor exercises and concluded that there is no credible evidence to support these exercises as therapies for developmental speech sound disorders. His conclusion is also consistent in regard to other communication disorders, as there is a lack of research literature. Next is a limitation of methodology. Non-speech oral motor exercises shortcomings include the unavailability of non-quasi-experimental or systematic research, not inclusive of all possible subjects, and is costly in terms of time and use of resources. Lastly, non-speech oral motor exercises implies that children have a deficit or weakness that requires treatment before or parallel to speech sound treatment. This implication spurred research on general and oral motor skills, as well as sensory processes that may underlie within a client with developmental speech sound disorders. Schreberg and Kwiatkowski's research findings from 1994 state that it does not support a muscle deficit hypothesis in this population, but we do not have any updated information based on that 1994 article. We will now look at how to implement non-speech oral motor exercises with children.
And we're gonna end it with a smack. Ready? Let's go. Like a puffer fish, and we're gonna hold it for 10 seconds. Now we're going to move our tongue from the left side of our lips to the right side, just like this. Ready? Let's do it. For this one, we're gonna do lip rolling. 10 times, okay? Short, but quick.
Now, does research support this approach? According to Russello and Bellino's literature review, no. Research does not support the use of non-speech oral motor exercises, as it does not result in a positive change in communication behaviors for children with cleft palate or speech sound disorders in general. Research within the literature reviews, as well as experimental research, supports direct speech treatment as an effective method for clients with speech sound disorders, not non-speech oral motor exercises. Are professionals supporting this approach? We are looking at the results of a survey from 366 SLPs who responded to questions about named interventions conducted by Brumbaugh and Smith. The authors concluded that more SLPs use traditional intervention over other types of intervention. Many SLPs use aspects of phonological interventions and phonological awareness training, while few SLPs indicate the use of non-speech oral motor exercises. I'd like to hear what you guys think. Based on the information provided, would you try non-speech oral motor exercises? Do you believe those exercises can influence progress in speech sound disorders? Have a discussion in the replies when this is posted, or answer the question solely for yourself. Here are the references used to create this presentation. Thank you.